So they said that this question is around what? Acute gastroenteritis. So this was the question. They said that a 1-year-old boy presented to the what? Emergency pediatric unit, that's the EPU. So the boy had a 2-day history of diarrhea, vomiting. So when you did some physical examination, you observed that the boy was drinking very thirstily, like he was dehydrated. So as we gave the boy anything to drink, he was now he was now rushing it. So these are the questions. What are the 5 questions, 5 important questions you ask in the history taking of this child? You should list the clinical signs you want to seek out for when you are doing a physical examination. What are the 5 investigations you order for from the chemical pathology lab? How would you manage the most likely diagnosis? Not only chemical pathology lab, hematology lab too. How will you manage the most possible diagnosis? And list the 5 differentials. Okay, of course, differential diagnosis. As a young doctor, as a young healthcare professional, they always like you giving differentials because you can't really always be sure. You understand? So 5 important questions you ask in the history taking is, sorry, I'm coming. So the 5 important questions you actually want to ask the child is, how long have the child been having diarrhea, and how many times do they stool in a day? What's the consistency? Of course, you're not asking the child, you're asking the mother or anybody that came with the child, right? Of course, a close caregiver should be available. They ask them if the stool has blood or mucus in it. Then for the vomiting, you ask about the frequency and nature of the vomiting. Is it projectile? Is it bilous? Then fluid intake, you ask what the child has been drinking. You ask about the urine outputs. Okay, how many times does the child urinate in a day? Okay, then you ask if the child is suffering from any other things. Do they have high temperatures, cough? Just find out any other problem that the child has apart from the diarrhea and the vomiting that the mother came for. Moving, then the 5 clinical signs you look out for. You check out for the mouth. You ask them to open their mouth and see if the mouth is dry, if the tongue is dry. Skin turgor, you pinch their skin and see if there will be a delay return. Capillary refill, you look at their general appearance. Are they irritable? Are they restless? Are they lethargic? Do you understand? So that's what we got. So 5 investigations you order for include things like random blood sugar to see if the child is hypoglycemic, stool microscopy or culture. You just want to see if there's blood. Okay, also pick up any microorganism. Probably there's 1 or 2 intestinal infections. Full blood count, malaria tests. Okay, if the child is living in an endemic area, you have to actually do a malaria test. So you can also do urinalysis, you can do blood gas, you can do electrolyte, urea, creatinine. So management of the most likely diagnosis. The most likely diagnosis is what? Acute gastroenteritis with some dehydration. Okay, so you have to rehydrate the child. So from the question, we didn't read anything like the child was unconscious, so you don't have to go in for intravenous treatment. You can give them oral routes of treatment. So you give them things like what? ORS. So ORS as an oral rehydration solution. You give about 75 ml per kilogram of ORS, and that's over 4 hours. Okay. Replace ongoing loss. That's about 10 to 20 ml per kg. Okay, for every stool. Okay. For every loose stool they pass. Then 5 to 10 milligrams, 5 to 10 mils per kilogram of each vomit. Then you supplement them with zinc, 10 milligrams daily for children. So you treat the fever, and if there's an infection, you treat. Okay. So you give antibiotics if you are suspecting for an infection. Keep monitoring them closely, their hydration status, educate the caregiver. Okay, they should know when signs of danger are coming up and the types of food the child will be needing as at that time. So other differentials, it could be what urinary tract infections, it could be malaria, it could be sepsis, it could be intussusception, especially if the baby is vomiting greenish vomit. That's a bilious vomiting.